my name is Caroline Nelson, and I'm the Director of Inpatient Dermatology at Yale. On National Dress Syndrome Day, the Dress Syndrome Foundation's Dress Smarter campaign brings together physicians, researchers, patients, and other advocates. It is my honor to discuss recent advances in dress syndrome research. Drug reaction with eosinophilia and systemic symptoms, DRESS, also known as drug-induced hypersensitivity syndrome, DIHS, is a severe drug reaction which presents with a rash, fever, and internal organ involvement. Scientists have known for years that DRESS syndrome is mediated by the T cell, a white blood cell that defends the body against infection and helps fight cancer. And while the T cell is critical to human survival, it can induce a life-threatening drug reaction in a patient who is allergic. Common culprits in DRESS syndrome include anticonvulsants, antibiotics, and allopurinol. And unfortunately, survivors may experience chronic organ dysfunction and autoimmune diseases. Research over the past decade, particularly within the field of T-cell biology, has advanced our understanding of how drugs interact with viruses and the immune system in DRESS syndrome. On a cellular level, we now know that multiple T-cell populations are involved, including Th1 cells, Th2 cells, and Th17 cells, which activate different branches of the immune system, and T regulatory cells, which globally suppress the immune system and promote viral reactivation. On a molecular level, scientists are beginning to pinpoint the specific role of signaling molecules. An important example is thymus activation regulated chemokine, TARC, which helps Th2 cells recruit eosinophils that injure skin and internal organs. These developments are vital not only to enhance our understanding of this severe reaction, but also to move the field into an era of targeted therapy. Currently, systemic corticosteroids remain first line for DRESS syndrome, and while these medications may be life-saving, they have serious side effects, including lowering the ability of the body to defend itself against infectious pathogens. So as a clinician, one of the most exciting areas of DRESS syndrome research is steroid-sparing therapies. Potential targets include interleukin-4 and 13 inhibitors, interleukin-5 inhibitors, and Janus kinase inhibitors. These medications are currently approved by the United States Food and Drug Administration for other skin disorders such as atopic dermatitis. They mechanistically hold promise in DRESS syndrome, but the evidence base is critically low. So one of the most important future directions for DRESS syndrome research is to conduct randomized, placebo-controlled, double-blind clinical trials in order to determine the optimal therapeutic approach. And we need to understand how the immune system response differs from one individual to the next. In this way, we can realize the promise of precision medicine in DRESS syndrome.